A lot of fascia here. Bang, another nerve let go then. He's pushing in for the pressure. And it's still letting go in front of his coupling and over the loins where the lumbar vertebrae are. Good boy, mate. Push into me. Now give him a little bit of room up, Pete. He might just turn around yet. Now there's going to be a bit let go. But not only that, when you take the pressure off the skin and the ribs, they can fill up their lungs more, and that's how they get the oxygen in the blood that goes up to the brain and then through the heart and the valves and the arteries. And it's the arteries that really transport most of the blood. I mean, his back's down, his shoulder's not right, his hip's not right, he's a bit of a mess. I mean, I only invented this tool after 1,500 horses or so because my hands were getting sore. It's just a branch off the edge of the driveway. But my hands were getting sore, you know, like on the race horses. This is at Warwick Farm. Even gentle little frictions, you know, circular friction, little sideway friction. With my hand saver, right on top of the vertebrae, you can see the reaction. It's like us when someone works along your spine nice. It's a beautiful feeling. Anything that relaxes you up here is good.
It's 90%.
Now I'm on this other... Yeah, here we go. Here we go. Now he's pushing into me again. You see the tissue picking up through his lower back? He seems very calm now. He's quivering in the muzzle a bit, closing his eyes. That's, oh yeah, I'm enjoying this. You just got to think like the horse does. And they're not in a hurry. Thinking about it with ears like that. Hasn't showed any sign of aggression, bit of a fright from a bit much pressure. I mean, look, geez, there's a lot more to get through yet. Do you want to come and hold him again for us? Yeah, now he's pushing into me again. It'll be like the other side. Give him a little bit of lead there, Pete. And he'll probably turn around. And as they turn around, the tissue just lets go. And the wonderful thing about this therapy is taking all the pressure off the muscles just gets the blood flowing. And I expect this horse, by the time I'm finished with him, he'll go out and do a big pee. Because I'm getting the pressure off his bladder and his kidneys as well. If a horse doesn't pee or poo properly, you worry, okay? Because you know things aren't right. Just there it is, right there. That's when it's tight. See the tissue letting go as I work through there, through his ribs. There you go. That's it. He's saying to me, there we go. Moving the tissue through here behind me, coming into the hamstrings. Hamstrings. These aren't too bad. But when the hamstrings get tight, they pull the pelvic girdle down. Problem in the coupling or the sacroiliac. He's got a bit of stress on his pelvis, this boy, judging by that look better than what I'm doing. But it's been there for a while. He says to me, yeah, I like that. Look, I'm hop skipping and jumping all over. Yeah. It's not like a normal treatment.
But yeah, it's just questions of if you know, I come across this again, that it is not the horse's life's not, you know, done and dusted because they can't move.
They're never done and dusted. Yeah. They just got to get the blood flowing.
Right.
When the blood's not flowing, it causes the most weirdest problems in the world.
So when the bum's like that, there's a definite ligament and muscle problem.
Yeah, and nerves, nerve branches, about the thickness of my... I've dissected one at the abattoir with the boys, and he's felt that straight away. The stress has come down the leg from the hip. All right, we've got the shock out. Now I can just work that muscle over a bit. They love this too as much as their front. They just love getting their legs done. Vets don't do a lot with their legs. Or, you know, I've worked in plenty of stables to know that. And I've spoken with a lot of vets too. And that's pretty tight there, I tell you. The same as our calf muscles here. This is the equivalent of the ankle. It's like three big tendons in one. This, the calcaneal or the Achilles heel of the horse. I'm just going to give that little bit of a stretch out. That's right on the point of the hock, on the protuberance.
So if a horse is trotting short behind, it'll all be tension.
Yeah, that's all it is. It's the same with this tendon here. See, he's getting a bit of a, oh, I feel that, so his leg's not on the ground, but it'll go down in a minute as soon as I get the stress out of it.